If you're thinking of going flat after mastectomy, in this video I'm going to share with you the top 5 things you need to know about aesthetic flat closure. Most importantly, I'm going to explain to you how it's different from simply saying no reconstruction to your breast surgeon. Hello there, I'm Dr. Wai-Yee. I'm a board certified plastic surgeon. I specialise in breast reconstruction and breast rejuvenation. I work in a busy cancer centre here in Los Angeles. In this video, I'm going to explain what aesthetic flat closure is and what you need to know if you're thinking of having this surgery. So the first thing you need to know is what is aesthetic flat closure or going flat. So if you've been diagnosed with breast cancer and recommended to get a single or double mastectomy, you have 2 choices. You can either get breast reconstruction, whereby a breast mound is recreated, or you can say, I don't want reconstruction. Not opting for reconstruction typically means that your breast surgeon is going to simply close the wound after mastectomy. And in some patients, this can result in extra hangy tissue on the sides, what we call dog ears. And I'm going to share with you some examples later on in this video. Increasingly now, women are asking to have more symmetric looking tidy scars after surgery. And what this means is having aesthetic flat closure. The second point is, who does the surgery, the aesthetic flat closure? Well, the breast surgeon already said does the mastectomy, and typically here in LA, the plastic surgeon will do the aesthetic flat closure. Our focus and training is on making things look as beautiful and symmetric as we can. For instance, I use dissolvable sutures so you don't get those ugly stitch marks that you sometimes see in wounds. The third point is, which patients benefit the most from aesthetic flat closure? Well, of course, everyone wants symmetric and beautiful looking scars. However, if you're heavier or you have large breast size, you're more likely to have those dreaded dog ears and that extra redundant tissue I talked about earlier. So clearly, those are the patients that will benefit the most from aesthetic flat closure. The fourth thing I need to tell you about is what to expect from the scars. It's so important, I cannot emphasize this, that you talk to your surgeon about how they're going to do the scars, what is the direction of the scars, and what is the length of the scars. When I see the patient initial consultation, I show them examples of patients that have had flat closure by me. An alternative is to use a scar chart. So Kim Bowles has made a really useful website called Not Putting on a Shirt, where there's some really good examples that you can use. And you can bring that chart to your consultation. I'm going to put a link to her website in a video description below. I like what's called the U-shaped scar. I prefer to call it a smile scar. And I like to keep the 2 scars separate if you're having a double mastectomy, rather than have a once across scar, which I find quite hard for patients to wear clothing. So the 5th and final point is, what about the timing of the flat closure? Well, there's 3 main options. There's immediate flat closure, meaning you get your mastectomy done and the same day your plastic surgeon will do the flat closure. The way I do it is I meet the patient and the breast surgeon at the time in pre-op before they go on to do the mastectomy. I do the markings, they get the mastectomy done, and then I get called to the operating room where we'll make any necessary readjustments, and then I will do the flat closure. The second way is what's called revision or delayed flat closure, meaning you have your mastectomy done and then you get your flat closure performed many months or even years after the mastectomy. And typically these are patients that have left with scars that they don't like. This is my least favorite because it's very restricting and confined to what we can do sometimes, depending on what's been already done by the breast surgeon. The third way is what we called immediate delayed, which is a bit of a hybrid in between 1 and 2. So that means that I see the patient in consultation before the mastectomy is done, I plan out the incision, and then we book the flat closure, typically 2 weeks after mastectomy. The best benefit about this way of doing it is that we have the pathology results back by the time I do my closure, so there's no surprises, and we know for sure that the breast cancer has been removed and all the breast tissue that was planned to be removed has been removed. The other benefit of this way is that patients who are out of town can still have access to a plastic surgeon, and that way they can come back and have that second surgery, and the 2 surgeries are separated. That is also a disadvantage because instead of getting 1 long surgery on the same day, you have 2 shorter surgeries. Earlier this year, we presented our work at the California Society of Plastic Surgeons meeting in San Francisco. We showed before and after pictures of patients who had undergone delayed versus immediate flat closure after mastectomy to plastic surgeons and asked them to rate them based on appearance. And what we found is that those who had immediate flat closure had significantly higher aesthetic scores compared to those patients that had delayed closures. In figure 1, the picture on the left shows a patient after double mastectomy performed by the breast surgeon and closed by the breast surgeon. As you can see, the patient has very asymmetric scars with large dog ears, and she was very unhappy, and she lived like this for about 6 months before I did her surgery. On the left side is after I performed delayed aesthetic flat closure. The patient is very happy with the result because it is a big improvement. However, I think the results are suboptimal. In contrast, in figure 2, the patient on the left hasn't had surgery yet. She hasn't had a mastectomy. And then we did the mastectomy with the flat closure on the same day. And you can see her after picture on the right, which is considerably more symmetric and pleasing looking compared to the first patient I showed you. Lastly, in my practice, I usually have my patients go home the same day or they go home the next day. Two things that are really important. I always place drains. It's critical. And if you don't know about drains, I'm going to put a little link to my blog site down below. And the other thing is that all patients must go into some kind of compression garment. And this is to prevent them getting what's called a seroma or fluid buildup. I hope you found this video to be useful. If so, please like and subscribe to my channel, and I'll see you at the next video. Aesthetic flat closure is becoming more and more popular, and it's really important that you know what you're signing up for.